Let's take a look at the section of Chapter 3 that focuses on how the environment influences prenatal development. This PowerPoint will also focus on the birth process and the newborn period. So let's talk about how the environment influences prenatal development. Teratogen or teratogen, it's pronounced both ways, impact prenatal development through 4 factors. What is the dose of that teratogen, how it affects, how the genes affect that part of the environment, cumulative effects, how often does it happen or how long, and then the timing of the exposure during prenatal development. So let's take a look at smoking and nicotine. Nicotine inhibits the availability of oxygen to the fetus, and smoking may alter the embryo's epigenetic profile or its emerging genetic profile. And so smokers tend to have babies that weigh less. They have a higher risk of miscarriage and having a preterm baby or premature baby. It's associated with higher incidence of diseases in childhood like asthma, cancer, type 2 diabetes, or heart disease. And sudden infant death syndrome, in which an infant under the age of 1 suddenly stops breathing and dies, is linked to smoking during prenatal development as well. Also, alcohol, drinking alcohol, we call this fetal alcohol syndrome because we're not quite sure how much alcohol it takes to cause it. Some alcoholics have children that are born without fetal alcohol syndrome, and others who say they just drink once in a while have children that do have fetal alcohol syndrome. There are 3 subgroups. There's the classic fetal alcohol syndrome, which exhibits unique facial deformities and mental disabilities. There's a second group that only shows some of the facial and cognitive symptoms. And then the third group has cognitive impairments, but no physical defects. Drugs, it's difficult to estimate the individual effects of cocaine, heroin, and marijuana on prenatal development, but substance abusers are likely to use many substances at the same time, like they might also smoke. Women with substance use disorders are more likely to have mood or anxiety disorders, and they may be self-medicating with those drugs. And that anxiety and mood issue is going to affect what happens with that baby after they're born. Mothers can pass disease or the effects of disease to infants in the placenta in 2 ways, through the placenta and through the birthing process. If the mother has not been vaccinated against rubella and they get rubella while they're pregnant, that will affect her unborn child, and that would be through the placenta. And the birthing process is where the effects of HIV appear, and this is the virus that causes AIDS. Also, diet can have an impact. Records of food availability over the last 150 years show a pattern in which males who overate in years just before puberty tended to have sons and grandsons with higher risks of diabetes, cardiovascular disease, and early death. Older fathers are more likely to have children with schizophrenia, autism, and reduced IQ or social functioning. And so here is a chart that looks at research on the effects of father's health and age on prenatal development. And you can see as the father gets older, at the time they conceive the child, then there is a gradual increase in the number of mutations of their genes. So another effect on prenatal development is prenatal care, and many women in the United States don't have access to quality and consistent prenatal care, or they choose not to participate. And three major groups show differences: teenagers, African American mothers, and Hispanic mothers. They're more likely to have low birth weight babies or preterm babies than non-Hispanic white mothers. And preterm is premature. Nurse family partnership programs have been established to try to provide that prenatal care and encourage mothers to participate in prenatal care. And so let's take a look at sensitive periods in prenatal development. And I'm going to click all the way through. And so here you can see in the first part of development, in the germinal period, there usually is not exposure or any effects from teratogens. But in the embryonic period, you can see with red, it has a huge effect on the central nervous system, on the sensory system, on arms and legs, on teeth, on the palate, the brain, and the ear, and external genitalia. And you can see the red is the most critical period, and the blue is less effects. And then you can see, so really the embryonic period is the most sensitive period of development, but it does continue into the fetal period as well. And you can see on the bottom it says that outcomes would be for if there's issues in regards to teratogens. If that were to happen, usually there's a miscarriage in the germinal period. In the embryonic period, there are major structural abnormalities. And in the fetal period, there is physiological defects and minor structural abnormalities. During pregnancy, the weight of the mother is monitored as an indicator of fetal health, and an ultrasound produces a sonogram image, and they are regularly utilized today in prenatal care. Other samples that can help us determine the progress of pregnancy may be amniocentesis, and using an ultrasound image as a guide, the physician inserts a thin needle through the woman's abdomen and obtains amniotic fluid, which contains skin cells sloughed off from the fetus, and DNA tests are conducted on the fetus's skin cells. And then the CVS sampling would be the fetus's DNA can also be obtained by CVS, and this can be carried out vaginally or through the abdomen as shown here. And it can be just as safe as amniocentesis and provides the results much more quickly. Also, a blood test can be used a triple screen test, which looks at the alpha fetal protein. This is a protein produced by the fetus, AFP, or the human chorionic gonadotropin hormone produced in the placenta, or estrol, which is estrogen produced by the fetus and the placenta. And so some reasons for infertility might be in males, a low sperm count, in females, damage to the reproductive system, the age of the parents, and there could be other unknown causes. One of the techniques that can be utilized is in vitro fertilization, and this is fertilization outside of the uterus, and the embryos are transferred back to the mother's uterus. And here in phase 1, the hormonal stimulation of egg release is carried out. In phase 2, placement of these eggs in a petri dish with sperm, hoping that the sperm will fertilize the eggs. And then cleavage of zygotes in the culture and medium until 4 to 8 cells are reached. And so there's zygotes, and they want them to divide several times. And then in phase 4, they're transferred 1 or 2 cleaving embryos into the uteral cavity with a catheter inserted through the vagina and cervical canal. Okay, so now let's look at the birth process. Oxytocin starts uterine contractions, and labor is the uterus contracting at regular intervals and gradually pushing the baby out through the vaginal opening. So let's look at the 3 stages of childbirth. Stage 1, the uterus pulls on the tight ring of the cervix in a process called dilation, which expands it from less than the normal 1.1 centimeter diameter to about 10 centimeters, which is about 4 inches. The contractions of the uterus in stage 1 also pushes the baby's head downward so that it presses against the cervix. The stage averages 12 hours with the first child and about 7 hours in subsequent births, but that varies by individual. And you can see they're face down with the face facing the mother's spine. That's the ideal position. Stage 2 is the birth of the baby. Uteral contractions and the efforts of the mother combine to push the baby head first through the birth canal. The baby's head is soft because the bones of the skull haven't fused together so that the head can fit through and the skull bones can overlap. This second stage lasts 20 to 50 minutes, and once the baby is breathing, the umbilical cord is cut and the short remaining stalk is sterilized, and it will fall off in about a week or so and reveal a belly button. And then the final stage is the placenta is separated, and the uteral contractions pushes the placenta out along with other the amniotic membrane, chorion, and the umbilical cord. And this lasts about 15 minutes. Okay, so that's a normal or typical birth. But sometimes the position goes awry, and so here are some examples of positions that don't work out very well. the sideways position of the head, facing, instead of facing down to the spine, the face is out towards the pelvic bone, or maybe the fetus is trapped in the pelvic bones altogether, or maybe they're going instead of head first, folded knee and bottom first, or maybe toes touching nose, or one knee up and one leg out, or both knees down. And so that can cause complications in childbirth. And so there are different ways of delivering a baby: the hospital birth, a midwife, or a doula. And there's no evidence that prepared childbirth produces healthier mothers and babies compared to standard medical practices. So it's a matter of choice, but mothers should be well informed and supported. Pain management is generally with an epidural, and that's the most common, and that's just a local shot to deaden the nerves in the vaginal area, and that also allows for a suture or a surgical cut so that there's no ripping of that area. C-sections or C-section accounts for approximately 1/3 of the births in the United States, and fortunately that number has gone down from what it was a while ago. So then after the baby is born, an APGAR test is always done, and this is an example of the APGAR score. They look at the baby's heart rate, their respiratory effort, their muscle tone, their body color, and their reflexes. And so these are examples of what a low the scores might be: a 0, 1, and a 2. There's also another neonatal assessment that's done later on, and this is the Brazelton Neonatal Behavioral Assessment that's actually done a couple of times. And this evaluates infants' reflexes, their ability to respond to people, control of their own behavior, attention to objects, and other stimuli. So it's looking at a more diverse range of abilities. So the most common birth complications in the United States are preterm or premature births with a gestational age of less than 37 weeks. And this is about 12% of births. Low birth weight would be full term, 38 weeks or later, but weigh less than 5.5 pounds. And this is 8.1% of births, so there are less of these. And then very low birth weight would be less than 2.5 pounds. So preterm babies or premature babies have health risks because they haven't completed prenatal development, and so their lungs, immune system, and digestive tract are not mature yet, and so they may experience respiratory distress syndrome. And kangaroo care has been a technique that might address the issues of preterm babies. And so the mother is encouraged to stroke and massage their baby and talk to the baby and to breastfeed the baby. And then the baby is clothed only in a diaper and a hat to prevent heat loss from the head, and held upright against the mother's bare chest for up to 3 hours per day, like a kangaroo baby in a pouch. And so that's to encourage maturity and production of hormones that promote development. Preterm babies have better outcomes when their weight is appropriate for their gestational age. Small for date preterm infants have a greater risk for negative outcomes. And so risk factors that were present prenatally continue in postnatal environments. It's like postnatal environment conditions may complicate preterm or low birth weight problems. So there may have been environmental circumstances that caused the preterm or low birth weight, and this may continue, those causes may continue even after they're born.